This is web editor Nicole Raleigh, and today I'll be speaking with Lee-Ann Farrell, Head of National Programs at Johnson & Johnson, for a conversation on what delivery will look like in practice when it comes to the National Cancer Plan, the 10-year Health Plan, and the Life Sciences Sector Plan. Welcome, Lee-Ann.
Welcome to me, and thank you for the opportunity to have this conversation today.
Now, our discussion comes ahead of the NHS Confed Expo, but before we sink our teeth into the proposed topics at hand, Lee-Ann, I was wondering if you would, as our guests on the pharmaphorum podcast, do indeed briefly introduce yourself for our listeners and describe the journey that led you to doing what you do today in your role at Johnson & Johnson.
Yeah, thank you. So I'm currently in a role as Head of Government Affairs and National Programmes at J&J. And that basically means that I work at that intersection between policy and delivery. So really, it's all about turning theory into practice in the real world. And I've been at J&J for over 25 years. Is coming up for the 3 decades actually, and I've always worked in roles that are national market access, regional market access, local market access. So always in that policy development and system transformation space, and always really focusing on making sure that patients who can benefit from innovative treatments do get them in a timely way and really without variation that's based on where they live. Brilliant career. I've thoroughly enjoyed my time here. And actually perhaps a highlight for me was when I had the opportunity to lead the vaccines business at J&J during the pandemic. And that really was all about translating scientific innovation into rapid and large-scale delivery under pressure. And it just reinforced something in me. And I would come back to it today, that innovation, it really only matters if it reaches patients and it reaches them in time. And actually, that's true as I sit here today, right? So 400,000 people a year getting a cancer diagnosis in the UK, something like 1 every 80 seconds. So the scale of the challenge and the urgency of the challenge in terms of patients, people getting that right treatment at the right time, at the right point in their pathway, it's real. It's real. The challenge is real, and it's brought me to where I am today. And it's what motivates me to keep doing what I'm doing, even after all this time at the company.
All this time? Well, I'm sure you have many stories to tell, Lee-Ann. That sounds quite the journey thus far. But if we focus on the urgency of the challenge, this making sure that patients who can benefit do benefit from the treatments that are out there, I wondered if we could first of all discuss what comes next following what can be described as very clear policy direction from the plans, including how the system can move from ambition to actual implementation, particularly in ensuring innovation is adopted consistently and, importantly, at pace across the cancer care landscape you just described.
Yeah, and I think that is what's really striking about where we find ourselves now in the UK, right? We do not have a strategy problem anymore, right? We've got clear strategic direction, and actually we're all aligned behind it as a vision. So yes, the National Cancer Plan, the 10-year Health Plan, the Life Sciences Sector Plan, and others, right? So I'd say we're at a crucible, we're at a moment where the question that needs to be asked now is not about what needs to be done, but it is about how is the system going to organise itself so that we can deliver it at pace and at scale. And I would say we're in a good place. And, there are some strong foundations already in place. So real progress being made in things like genomics, genetic testing, diagnostics. They are becoming increasingly embedded in care. And there is real momentum behind innovation. But there are some challenges, some serious, significant challenges that need to be addressed. And the truth is, the UK, we do lag behind comparable countries, when it comes to access to innovative medicines. And we do have a relatively low spend per patient on innovation. And, when we talk about system readiness across, diagnostics and workforce and infrastructure, and we'll come to more of that, but it does remain a key constraint. So what comes next is some practical next steps, right? So, and it's all about, how do we embed innovation into care pathways? How do we make sure, right, that there's this faster uptake of innovation, and how do we make sure that you get the same care wherever you live across the UK? Because ultimately, where a patient lives, that should not determine the care that you receive. But we're still seeing at the moment that gap between what's possible and what a patient actually experiences. So, yeah, we're on the precipice of the delivery chapter, I would say, and there's a lot of work. There's a lot of work we've got to do.
On the precipice of delivery and change. So let's hone in now on those practical next steps. And what can you tell us about actually how innovative medicines can be embedded within that care pathway? Yeah.
Yeah, and this is in my opinion, right? But I think what we really need to see is a mindset shift. And I think we really need to start to recognize that innovative medicines, they're enablers of this system transformation that we're all aligned behind and saying that we want to see. So the way I think of it is, people are becoming increasingly familiar around the three shifts. And we've heard that played out through the policy pieces, and hospital to community, and sickness to prevention, and analog to digital. But we need to bring into the consciousness about this fourth shift, right? The critical enabler that innovative medicines can be. They're not an add-on. They're the oil of the machine. They're what will drive this system transformation. And what I mean is that timely access to the most innovative treatment or intervention, that is what will turn an early diagnosis into improved survival for somebody. Or it could be that innovative treatment, that is why that person will live longer and enable you to live better with cancer, for example. Or it can be a critical enabler of supporting care closer to home if you use the latest, most appropriate innovative treatment. Innovative medicines, they add value through their secondary prevention potential, right? They can halt disease progression. So I think it's about seeing them as having that role within a whole ecosystem that will drive the change we want to see. And they can have a direct system impact as well. So if you slow somebody's disease progression, for example, that will reduce the hospital demand for that person, and it frees up capacity. So to my mind, all of these pieces of the jigsaw are symbiotic. I'm really mixing my metaphors there, but to realize the full value of innovative treatments, then we do have to design our pathways differently, and we have to think about medicines at the outset, not as an afterthought and not as a bolt-on. So I really passionately believe that innovative medicines have got their part to play in the new world that we're all aligned behind the vision of. But there is work to be done. There are structural barriers and practical barriers to the uptake of innovative medicines if we want to see them positioned in an optimal place in a pathway. So things like timelines for NICE appraisals, things like the commissioning complexity that we see across NHS England that really can be tricky to unpick. We have to make sure that things like diagnostic capacity is keeping pace with these innovative treatments as they're coming through the pipeline, because ultimately innovation's only got value if a system can take it up. And like I said, access to innovative medicines in the UK, we do lag behind. I think we're 15th in Europe in terms of our cancer medicine usage, and that's not good enough. That's not good enough. So that's the work we have to do, and that's where innovative medicines can play a part in moving us up those rankings.
As you say, not good enough at all. You were speaking then about the whole ecosystem in terms of the health ecosystem, but I want to broaden out slightly to the national system, if you will. So, if we're
Mm.
thinking about innovation, we necessarily have to also consider growth and system sustainability. So, when it comes to innovative medicines being drivers for potentially drivers for better patient outcomes, we also have to consider how they can assist in contributing to economic growth and system sustainability when it comes to, as you were discussing, the longer, better life of
Mm.
people, of patients, of
Yeah.
people with cancer. So, what are your thoughts here about the role of innovation within medicine when it comes to that system consideration?
Yeah, and actually, I think this is where the conversation is perhaps evolving in a really important way. You know, this will be new thinking for some people, but I mean, I think it's kind of critical that we all start to grasp the interplay, right, between health and wealth. And we are shifting from seeing innovation purely in those clinical terms to recognizing the broader value to the system and the economy that it can bring. Because if patients are diagnosed early and treated effectively, they can stay healthier for longer and they're able to potentially participate in the workforce again or for longer. And then the pressure on the NHS is reduced, which has a benefit, a system benefit in and of itself. And actually, there is increasingly strong evidence to support this, not just as a theory, but that it's true in practice. So the ABPI, we've recently just commissioned a new piece of research, and it says that improving access to innovative medicines could deliver about £17 billion worth of productivity gains in the UK. We know that healthier populations are associated with increased employment and increased economic participation. There's other research that's recently been published that says that targeted use of genomics also associated with measurable savings and productivity benefits if they're used at the right point in the pathway, if they're given early enough in a person's treatment journey. So we are starting to think as a whole ecosystem about uptake of innovation, not just as a healthcare issue, but as what it really is. It's about driving economic resilience for the UK. It's about long-term sustainability of the system. And I think all of this, you have to think of it as it's a virtuous cycle, right? And it just reinforces that message that medicines, innovative treatments, they shouldn't be seen as a resource drain or a cost. They're an investment. That conversation is happening, is live, and it's very exciting to be working in the industry at a time when people are increasingly starting to recognize that.
Yes, I mean, it does. As a journalist, you do listen and you think, why are we only talking about this now?
Mm.
It does seem rather delayed in that respect, but it's good that we very much, or rather, industry very much is focusing on this finally. So I just want to come back slightly to the barriers you mentioned earlier, Leanne. Thinking about the importance of finally aligning diagnostics, of aligning treatment, of aligning with those system infrastructure. It goes without saying this is important, but how can, in this regard, the system and indeed industry's role within that system support to that effect?
Thinking about delivery and alignment of everything that enables delivery, that's the sharp end of my role. So when I say, you know, that's when the theory does turn into real world practice. And in fact, I think precision medicine probably is a really good example of why you've got to get alignment right. So precision medicine, personalized treatments, and the, they're here, right? It's not the future now, they are here, but they can only deliver proper value if a whole pathway is working together. So that's from the genomic testing through to then making those treatment decisions and through to delivering whatever is deemed most appropriate for that person. And I think I said a little bit earlier that real progress has been made in the UK in terms of genomic testing and genetic testing. But now we have to ensure that that progress is matched by consistent and timely access to the innovative treatments the testing is designed to unlock, right? Because otherwise, that's a block. And that's a point where we see a disconnect and some stalling. And we do see disconnects throughout the system at the moment between diagnostics and treatments. And I mean, in some cases, there can be up to a year in terms of a delay between a HTA approval of a treatment, so a nice positive recommendation, which is access, in with one definition of access, but then availability or routine availability of the diagnostic test that's needed to determine which patient could be most eligible for the treatment that's been recommended. So those sorts of disconnects and misalignment, that needs to be ironed out because it has an impact for the outcomes of that actual person. And what we're talking about here really is flow. So if flow breaks down, then the patient will experience delays. You get all sorts of inefficiencies increasing up and down the patient pathway, and you get pressure then building in a system. So what we're working towards and what we need to see is that seamless flow between, you have innovation discovery, you have R&D, you have diagnosis and all of the really sophisticated diagnostic testing in place. You have optimal treatment embedded at the right point in a pathway, and then you get patient benefit. But it does mean that you need all sorts of jigsaw pieces coming together to create a whole picture. So, diagnostics, but and workforce and data infrastructure and commissioning. Because if you don't have it all properly lined up, I mean, innovation, it still exists, but patients won't benefit from it, and not in time and not consistently. And in fact, I was just reading something that the King's Fund have published on this, and they're saying that delivery of the ambitions of the National Cancer Plan hinge on whether these ducks can be set up in a row, whether there will be proper alignment across the NHS. And we stand ready, willing, able to assist in that work, because that's where you can kind of see maximum benefit for patients, for system, and where you get the most job satisfaction in a role like mine, being able to contribute to that effort. So we know what needs to be done, and we are starting to do it.
It's just wonderful to hear. Yeah. If I paused then, I was just sort of contemplating everything that we've been discussing today. So with J&J, with industry at large standing ready, willing and able to affect this necessary future for patients, for better patient outcomes. We've been speaking in metaphors of ducks in a row and jigsaw puzzle pieces to be completed for a healthier, fuller picture. My final question for you today is whether you have any closing thoughts to leave us with ahead of the NHS Confed Expo that listeners should quietly ruminate over.
I do. I mean, I really try to make the case for all parts of the ecosystem, for all external stakeholders, to recognise the value of partnership and how to realise these ambitions. No individual organisation or part of the UK can do it on their own. And I genuinely believe that if we come together, we can be greater than the sum of our parts. And I would say from a J&J perspective, I just want people to recognise and realise that the pharmaceutical industry, our role in all of this is not just about bringing those innovative treatments to the market. we also stand ready to support and partner and collaborate on the real world delivery to make sure that real people do benefit from these innovative medicines. So, I mean, I know we've got many examples at J&J where we're doing good collaborative work in areas, in places and spaces across the UK. So, and as I said, it's not just about the medicine. You know, we are able to partner and support in AI-enabled identification of high-risk cancer patients, for example, to make sure that the screening really is kind of pulled through in areas. We're doing lots with digital mapping of pathways to look at where's their bottlenecks, where's their fragmented care, so that can be improved. We're doing lots around service redesign to release capacity. I know there's a big piece going on in Cambridge at the moment. So there's lots of examples that show what's possible. The key challenge, of course, is consistency. And I'm going to say that, you know, when we go to NHS Confed Expo, and we're going to be there in June, I'm going to be there. So we'll be contributing further to these really important conversations. We'll be looking to engage with people, like-minded people who also want to support in moving from ambition to implementation, because actually that's when we'll know whether any policy piece has been successful. It'll be when patients themselves can genuinely feel a difference, when we know that no patient is missing out. And I think there'll be lots of those sorts of conversations at Expo. And I think most people are, you know, have the same sort of feeling that if we can get this right, the impact will be phenomenal. Patients will get the care they need, outcomes will improve, a system will become more sustainable, and hopefully we can move up those rankings, because we don't want to be lagging behind on preventable and treatable mortality. We want to be a country where innovative cancer innovation is delivered and not just discovered.
Thank you, Lee-Ann. Well, here's to those conversations, and here's to your time given to today's conversation. Thank you very much for that time. It's been a pleasure.
Thank you very much. I've really enjoyed it.
And that concludes another episode of the pharmaphorum podcast. You can find more information about this episode, including a download link and information about previous installments at pharmaphorum.com/podcasts. The pharmaphorum podcast is also available on Apple Podcasts, Spotify, Overcast, Pocket Casts, Podbean, and pretty much wherever else you download your other podcasts from. Just search for pharmaphorum and follow and hit subscribe. Of course, don't forget to visit our website itself, where you can sign up for daily and weekly news and analysis bulletins. And do follow us on Blue Sky and LinkedIn at pharmaphorum. That's all for now. Thank you for listening.